My father was a force of nature. He was driven, and for the best reasons. He would say, "Don't expect to get popular, mija, when you take care of the needs of other people who need help." Even 2 weeks before my father passed, he traveled to a convention to advocate for health care for Latinos.
He was an advocate for the poor, for all Latinos.
He fought for access to health care for everyone, and he fought against assisted suicide.
He worked with Cesar Chavez, fighting for farm workers and amnesty. He used to make fun of himself. He said, "Who would have thought that a 4'11" Chicano kid from the East Side, who was born crippled, would be working with the United Farm Workers, being their national lobbyist in Washington, D.C. and in Sacramento?" Sal believed that assisted suicide would hurt Latinos because they didn't have access to medical care. They were so sick, they didn't want to be a burden to their families, and to be asked that question, then it would be like coercion.
Our healthcare system is a healthcare market. It's an industry. When you introduce a market force as strong as assisted suicide, it obstructs care that families need. Assisted suicide is a cheap substitute for providing care for those who are ill. If we're committed to dignity, we need to fight for dignity at every stage in life, healthcare at every stage in life. From my father being born breech with a club foot to the end of his life, when the doctors could not figure out what was wrong with him, when his family traveled with loads of records to fight for him to get better, when we paid out of pocket for him to be relieved of pain. Healthcare began for my father when he was born, and all through his life he deserved healthcare. That's what every single person deserves. We deserve way better than assisted suicide.
My husband's work by any means is not finished.
Join us in continuing my father's work in fighting assisted suicide and fighting for greater and better health care for everyone.